So we enter the world of pneumatic, the invisible world of our breathing, what is not visible, what is linking our nervous system to the parasympathetic system. So the system of recovering, of gaining energies. And because in these days we were focusing a lot on the eyes and on the speech, I invite you to close the eyes so you will focus on other senses, and to close somehow, to feel that there is no speech now. We speak differently. And little by little, I would like that you focus with the pneuma, with the psyche, with what is invisible about our beings, about the empty space, about this side of the body that cannot be seen, but is made by breathe in, suspension, breathe out, suspension. It is a cycle between letting the air come in and then making a suspension, and then letting the air in your own rhythm come out, and feeling that there is a suspension also there before the air can come in again. And try to sense how, when you breathe in, you can breathe in one more time. It's like you breathe in and you make another effort to breathe again, to not breathe out immediately, but to enhance the breathing twice. Like breathe in, again, breathe in one more time, and then you breathe out. And again, when you breathe in, you make an extra breath in. You breathe in and extra, a little effort to breathe in more, and then you breathe out. And when you breathe out, please, you can make voice. When you breathe out, you can really Okay, and now before you open your eyes, please, while you can keep your eyes relaxed and closed, you stretch, you open the mouth, and you stretch out the tongue as the first organ for the baby that goes to space, and is the organ that is responsible for survival and for communication, and for the digestion, and for the balance, and for your posture then. So you just stretch very nicely out, and it's because we talk about censorship. Just because we talk about censorship. So open the mouth and you stretch out in which direction you want. As like a hand, you let out the thumb of the mouth. Out. The thumb is out. But out. And this is linking all the time the body, the physical, with the symbolic, the psychological one. Okay, and now you open your eyes. And the eyes of, look at the eyes of Rarița. Look at her. And she's telling everything about the process. Okay.
A bit of hesitation how to do, because Julia has a presentation, and if you sit here, you don't see the presentation. So we would like to invite Julia for. So I will introduce the next panelist, but I would start with Julia because she will be giving a short introductory presentation. So Julia, she has a background in both public health and arts and health, and currently working in the UK with the University of Bristol, and has been doing research and contributing to policy around how we can take care of artists that work at the intersection of arts and health. I'll prepare the presentation, so thank you, Julia, for being with us.
Thank you very much. It's been such a pleasure to be here and receive such a warm welcome from all of you. And so I hope that I have some things to share with you that will make us think about the people who are doing this important work in arts and culture and health. So let me start with a quote. I think this is important to hear the voice of the artist who is doing work in culture and health. This is an artist who's a circus artist. She works with people, young people who have type 1 diabetes to help them feel more comfortable in their bodies. And she says, it's easy, to take it all as a personal mission, that you're responsible for the people that you're working with. And whilst you know that you get the highs of all the positive experiences that happen, even that leaves you open to vulnerability yourself. You notice that is happening to you, that you are taking on board everything. You're like a sponge, almost. You soak up other people's conditions and what they're dealing with, and you're trying to figure out how to make it be a positive experience to these people and how to make it accessible to them. And you don't notice that you're soaking it up, and suddenly you're really heavy with it, with all of this. And then how do you get rid of that for yourself? And find time for yourself as well. I think this quote so beautifully encapsulates what we've been talking about the last few days, about how engaging it is for us as artists to do this important socially engaged work. So I want to tell you a little bit about some research that I did, both in my doctoral program in the UK with artists who work in hospitals and mental hospitals and with homeless people and other vulnerable people, but also some policy research that we did after that. So I interviewed 43 artists around England, and these are just a few examples of the kinds of conditions or situations that they worked with. All together, I think I collected more than 50 different kinds of health and social conditions that they had experience with. This just gives you a brief glimpse. As you can see, some of them very challenging. So one of my findings was that artists who work in a health or social care context have both rewarding and challenging experiences. They love the work, they love the feedback that they get from their participants, they see the benefits, and it helps their own well-being to do this work. but it can also be very challenging. They have to adapt their work for many different conditions. Sometimes there are very challenging behaviors that come up in the context of doing this work, depending on the setting. They often hear challenging stories of illness, of death and dying, of disclosures of abuse, and sometimes even suicidality in participants. So I like to think of this as the invisible labor of, that should be emotion work, but it's, as Valentina has shown us, work in motion as well. That there is the positive work that they do, the skills that they use. They have to create a positive atmosphere. They have to bring their energy and enthusiasm. They have to become attuned to the participants' emotions and situations. They hold space, they respond empathetically, and they're constantly devising creative solutions in the moment. But the other part of it is the needing to regulate themselves emotionally, staying calm in a crisis, balancing individual and group needs, managing personal reactions, joy, happiness, tears, anger, frustration, navigating both empathy with their participants, but also trying to figure out what's a state of detachment that they need to not become overcome with what they're experiencing. Because sometimes they bring their own experience to this work, and it can be very triggering for them at times of vulnerability. And often they just take it home with them. They think about it at night, they talk about it with their families, and so it can be quite involving. So these are some of the bigger picture challenges that we see for artists. In England, we call them creative health practitioners, but I think of them as artists and working in many different settings. There's the emotional impact and sometimes vicarious trauma of working with participants, the physical and emotional safety that they have to manage, and a lot of ambiguity about what are they responsible for. Are they responsible for making people better? Are they just there to do the art? Is it somewhere in between? Who has the duty of care? What's the responsibility for safeguarding? They often get participants who have physical or emotional needs who need their own support. One artist can't provide that support to a group full of people. And then there's the additional stress of precarity that we spoke about yesterday. And finally, many of them don't have access to support for themselves. Healthcare professionals or therapists, they often have supervision or managers that can help them. Artists often don't get this kind of support. So in 2024, we did a rapid evidence review and focus groups and a survey to try to get a sense of what was the state of support for artists in England who do this kind of work. And we were particularly interested in artists who work with adults in hospitals, young people with mental health conditions, people working in prisons, people working with migrants and refugees, and people working with older people, artists working with older people and in care homes. And one of the things that we found was that they described the kinds of supports that either they would like to receive in doing this kind of work or that they wish they had. And so this is just a list of the different kinds of support that can be possible for artists who are doing this kind of work. And you can see it ranges from therapeutic counseling and supervision to informal workplace support, which can be as simple as debriefing after a session with a colleague, participating in peer support groups, having your own self-care practices. Many of them spoke about how important training is to be able to be prepared to do this work. And so many different things. But what we also find is that while these are the ideals, most artists don't actually get this in practice. There's more awareness about this in England and in the UK generally, but actual money for this kind of support on the ground is still developing. So I just want to give you a few good practice examples. There are many, and in that report, Keeping Safe, which you'll get a link for later on at the end of the presentation, you'll see lots more examples. But these four, I think, are quite important. One is an arts NGO, Kazim Arts. They are an organization that provides creative activities to young people who've experienced trauma in their lives in whatever setting. And they, as a matter of course, in all of their funding applications, ask for a percentage of their grant to be dedicated to support for their artists. And they use this money to provide training to their team on self-care and well-being, to provide both individual therapy as well as peer support programs, reflective practice. And so it's completely integrated into their practice because they realize their artists are dealing with trauma, the trauma of their participants. And so that can affect them. Hospital policy. University College of London Hospital has recently instituted what they call a Creative Health Professional Care Charter. What it does is when they have artists come into their hospitals to do work with them, they provide this document that says, this is the kind of support we will give you. This is where you can get it. This is how you access it. These are resources you can get inside and outside the institution. And so there's a recognition that that care is part of what they should provide in addition to the pay and the projects that they work on. As it's mentioned yesterday, we talked about Arts Council England, which is the funding agency for arts in England. And they have clarified that, that artists can ask for support, not just for their participants who might have disabilities or have some other kinds of needs, but also for the artist themselves who is doing the work. And then finally, there's a brand new report that's just come out of the Jamil Arts and Health Lab and funded and supported by WHO, which is a guide for artists who are working in humanitarian settings. And it talks not just about how to set up projects if you're working in a disaster setting, in a war setting, in a refugee setting, but also how the artists can prepare themselves for this kind of work and what responsibility the organizations on the ground have for caring for the artists and the participants. So these are just a few practice examples. Let me say a little bit about policy and practice recommendations. These are also included in the resources which I'll share with you at the end. I think it's really important for everybody involved in culture and health projects, hospitals, arts organizations, funders, to recognize that there are very specific skills that are needed to do this kind of work. It's complex, it has an emotional impact, it's demanding. And I think I would use this as a point to say, I think more than anything, the best preparation for being emotionally safe and doing this kind of work is actually training. I think that many artists have found you can't just go from doing an arts practice or art school or a socially engaged kind of practice to working in a hospital or a mental health setting without knowing anything about it. And so learning skills, not therapy skills, but skills that can help you understand the context and the kind of work that it is the best prevention for reducing this emotional impact. I think funders need to address what I call the true cost of delivery. Oftentimes artists feel like they need to make their project budgets very small so that they can get the funding, and that's really a disservice to you and to your participants, because if you are overburdened, if you are working too hard, if you're not getting paid enough and you're not getting support, then you're not really able to do the job that you want to do. And funders need to recognize exactly what it costs. The preparation time, the support time, the time in between that often doesn't get counted, but sort of comes out of your own personal budget. And that funders and organizations should offer a variety of support options. Maybe if you work in a hospital and the hospital offers a bit of, counseling or support to healthcare professionals, that should be available to the artists too, because they're also working there with patients. I think it's really important for artists to really have a sense, who are you, who are we working with? Is this a patient, is this a group of patients who have dementia? What does that mean to work with patients who had dementia? What kind of support needs to be in the room? What kind of risks might there be? Is the activity appropriate to them? To really have a very good sense of how your art activity fits into the context and the patient needs. And that with the people that you're working for, to clarify roles, what's your role as the artist? Who has the responsibility for care? And what are the boundaries for each project? As I said, support's a part of funding bids. To plan for yourself, to know yourself, what are my own personal support needs? And to create a plan for yourself, a kind of well-being plan in advance so that you know what you need before and after you do a project. And then finally, again, the importance of professional development so that you can feel prepared to do this kind of work. This is a QR code for the resource list, which is online. You'll see the links to my research, to the Keeping Safe report, to other resources which I think are helpful to people who are doing this kind of work. And by all means, please get in touch. I'd love to have conversations with you about your work.
Well, thank you so much, Julia. This has been really illuminating. I would like to ask the other panelists to join us here. So, Ioana, Valentina, Dace. Yes. So let me introduce you our panelists. So you met Julia already, and you learned about her expertise. We also have with us Ioana Hirișcău, who is teaching at the Medical University here in Cluj, nursing students. I hope I'm using approximately right terminology for this. And who's also been part of a team implementing a project that she's going to talk about it, so I don't go into all those details right now. We have Valentina de Piante, who you also just met. She's going to stick her tongue out to us quite soon. She is a choreographer, dancer, and she's teaching at the UNATC, the University of Theatre and Cinema in Bucharest. And we have Dace, who is the head of Northern Dimension Partnership on Culture, which is an inter-governmental body of 12 Northern European countries. And they have these type of alliances for health and social well-being, but also one on culture, and Dace is leading that work and has experiences with arts and health. So we brought them together here to see how we can further go into the details of how do we take care in solidarity of the professionals that work in arts, health, and social spaces. And here Lorena is with me to ask smart questions. So I would go to Ioana first and ask you to share a bit of your experience in this recent project that you've been carried out actually together with Ioana and a group of other artists, and Ioana actually, the two Ioanas that are there and you met yesterday, in one of the elderly people's care homes. Please tell us about that.
Hello to everyone. My name is Ioana Hirișcău. Okay, I'm a clinical psychologist. I work in a hospital, ICU, so with critical patients, and I teach nursing at the Faculty of Nursing and Health Sciences within University of Medicine Pharmacy, Iuliu, Hațieganu. So I will try to provide or to give you some information about this project. I don't want to explain or to go too deep, in the matter, because it's a lot of I have colleagues that have very interesting things, or they said interesting things about this. I don't want to minimize our projects. I think it is important to show you or to present you, our experience, in conducting this project with students. Of course, I will start because the main objective of this care community so proposed or had, as major objective to examine the link between art community and care. So, but as you know, the things are not always go that they are planned to go. So Yes, we tried to make a selection, you know, of the nursing students. They, you know, this selection was based on voluntariness. We found this, established this group, but they had only, you know, involved in a first session with me. But another students which I work with, yes, they took part in this project from the beginning. Yes, with my colleagues, 3 artists that are presented here, Ioana and Ioana, and me, Ioana. Okay. So, what can I tell you about this experience? Very interesting, very emotional, very difficult to organize, you know, all, I would say, all these, you know, components of this project. I can tell you that some, you know, this project is ongoing. We will have another, you know, last session and the final presentation. But I want to tell you about my work in this project with the students. So we started, you know, to prepare some visits at the Caro Senior residence. This is the residence, is not far from Cluj. It's located in Gilou in a very beautiful environment. And we started with my colleagues to plan the visits and to go there, because you cannot, you know, implement any project if you don't know what are the needs, you know, of the beneficiaries. So we went there. We took part in their activities to see their daily routine and to take part, for example, in physical activity in the morning, and then to interact with them, you know, to see what kind of activities they take part, yes, participate, and finally, we decided to eat together with them in the same room. It was an experience, because eating is a social experience, and we saw something very, very interesting. They didn't interact with each other. Okay? So they interacted only with a social worker, but not between them. So it was a very point, you know, checked, and we said, yes, we have to work on this, okay, in this social interaction. So I prepared the students from psychology faculty to come with me. I had a session with them, prepared, because one of the objectives was a sort of evaluation of these beneficiaries in order to take part to our activities. Yes, and of course it was not a struggle but difficult condition until we reach, you know, to talk and to evaluate this. The beneficiaries, you know, a part of them, of course. And of course we have results. We have these results. We presented to the staff, to the staff of the Caro Senior residence. What I can tell you is very difficult for me to talk in English about this. I don't feel that I can, you know, provide you all the experience and emotional experience, but I want to read something from the students. It's their message, you know, related to their experience, and just to understand the barriers that we encountered in this, you know, kind of project. One of them, she wrote, starting this project, I expected to encounter barriers when initially communicating with the clients. Since we were outsiders to them, we were also introducing new activities which disrupted their daily routines. Many clients weren't used to our presence or the types of evaluations we were conducting. Here I learned the importance of how you approach the clients and the need for clear explanation before starting the evaluations. Creating a safe environment helps prevent any confusion about the purpose and steps of the evaluation, ultimately ensuring a smooth process. During this experience, I faced a few challenges. My main challenge was communicating with clients who had severe hearing impairment and did not use hearing aids. This sometimes caused confusion in communication, making the evaluation process more difficult. I had to adapt the evaluation process by modifying my speech and using visual aids. And just a few words from the other students. She said, one thing that really stood out to me was how many of the residents showed signs of depression or withdrawal. Some of them struggled to hear or see well, which made communication harder and often led them to isolate themselves or refuse to take part in activities. This withdrawal had a major effect on their mental health, in often cases expressing loneliness or even signs of depression. One of the most important things I learned while interacting with the elderly was the importance of communication. I realized that I had to speak louder and more clearly because many of them couldn't hear well, and I needed to give very simple step-by-step instruction to make sure they understood what to do. I also learned that empathy and patience go a long way. Showing understanding and kindness made them feel more comfortable and willing to participate. So I just want to, give you a picture, a small picture from our, experience. We wanted to involve students because we thought they need training in this. We cannot expect to have in the future nurses or psychologists, very good prepared to approach this patient if we don't want to involve them in these communities. So they need training, they need competencies. We have to produce something that make them prepared to work with these populations, vulnerable populations. Thank you.
Well, thank you so much, Ioana. I will pass, yes, indeed, to Valentina, because she's too working with students. So, what can you share with us?
Yes. So I take somehow your words like a manifesto. Even if we are not ready, we have to start to do something. And I start from community projects for mental health, people with mental health issues, special schools with neurodivergence, special needs kids. And from this project, I saw that there is not continuity, there is limitation, lack of resources. And so from this point of view, where we are missing something, I took somehow I was focusing actually on what is working. And what is working and what is at the core of special people is what is movement, is the non-linguistic expression. And so I start to, I'm really representative of a collective right now. I'm representative of a collective of artists. I'm not alone. In this moment, I really am like many bodies of dreams, of desires, of intentions to share soft skills knowledges that are coming from the dance and the somatic world. So I apply to AFCN as a collective, a real collective, with this project that is called CRESC. And CRESC, it means to grow a network of many things that are all together, that are not divided, that are health, education, creation. We perform in the halls of university, we perform in special schools, we perform in the hospitals. We don't need lights, we do interventions, right, like this, without the magic, without the illusions, really going straight ahead and to see how the people is perceiving. And we do the research because we have the partnership of the University of Padova, the psychologist, the psychology department that is big, is also philosophy, is a lot of things, but we have this kind of evaluation on two topics. There are the trainings for students. We will bring to UNATC 3 different trainings, and then on somatics, on dance, on dramaturgy for performances for community, and then bringing this kind of how can we make a company, inclusive company in Romania. The third training is about how can we build an inclusive company where we can find new vocabularies, new ways of connecting, new ways, new possibilities. And the very interesting thing is that somehow I had to, this project that is done especially for the new generations, and also for the students of psychology in Bucharest, somehow make me think about a new pedagogy. A pedagogy, because this was a question somehow, how all these roles, artist, pedagogue, Feldenkrais teacher, practitioner, are linked. So we are somehow working with embodiment. There are some key words: embodiment, resonance, empty spaces. We are trying really to create a space of a relationship between us and the students, us as teachers and the special need kid or the group with the mental issues. So we are working with tools that are quite specific, very, very specific, and at the same time integrating a lot of aspects of the way we are using the mind actually in the body, the way we are using intuitions, the way we are sensing, first of all, sensing ourselves and sensing how we prepare the field, because the field is not just the outside field, the in-between field, but is the field in yourself. How can you sense this field and prepare and move and shake it and empty the field? So we we are researching.
Thank you. Now we move to Dace.
Yeah, thank you.
Yeah.
It was so interesting to listen all of you because I just dropped a few bullet points what I would like to tell you about today, and it's so much reflecting what I was thinking during these days and way back at home. So Rarița, you asked me to talk a little bit more about the Awake project, but
Feel free to
okay.
respond the way you
I want
want.
as well a bit share with you a few reflections that I had, like about this caring about ourselves, about colleagues, about people with whom we collaborate in this arts and this health and social setting. We are really speaking always, I think, a lot about the relationship. Then we have like this human connection throughout the work, and I think this care is not the outcome that we are caring for someone, but it's somehow the process that is somehow shaping as well a lot our work, what we are doing, because we are collaborating in between us, and even if we are like super institutional organization and we are not the practitioners, we are more like contributing to the policy making and networking. However, we feel this necessity to care for each other and to contribute to the ecosystem and support the ones who are doing all the work. I think this care for self-care and this collective care is really deeply interconnected. And I think that this support for others and as well like daily work and support for the colleagues it is really requires a lot of emotional energy and creative energy, and which means also we must create some kind of structure and the time to make it all happen, and as well some space for reflection and the mutual support. And I think in our daily lives it's so difficult to find this space if you like physically don't book this in your agenda, so it doesn't come naturally, but how much we would wish that it does. And I remember yesterday we had lots of talk about this system, that we need the support from the governments, from the local community, that they recognize our work as a real skilled labor, that doing cultural work is not just like about having fun, and that we are provided by the fair pay, that we have this psychological support and opportunities as well for the training, that I think is really essential and crucial here, working in this new emerging sector. At least for us it's quite new, and we are more than learning by doing. I feel it like that. And actually institutions and funders can play really crucial role here, I think, here in building these supporting environments, and where artists are not only delivering this care and services, but they are also cared for themselves. And from this reflection, Awake project was born. This is the project that is co-financed by the European Union, and the long title of it is Arts and Well-being as a Creative Business and Sustainable Livelihood. This is the project that we implemented together with our dear partners. We had nice consortia with Cluj Cultural Center, Arts and Wellbeing Center in Helsinki, Lapinlahtilahde, and region in France. So they have really already like very well established these systems. But together we learned really a lot of new things, because our focus was not general arts and health, but it was like more on the creative business. And within this project we thought to give to artists tools, like that they can become more independent, not only rely on the public funding, that they can be more self-confident, that they could sustain their income and sustainability, not only in terms of like this ecological and financial sustainability, but as well this emotional and ethical and communal. So we had, when we started the project, I thought, oh, only few activities, but at the end of the day, it was quite intense process. We had several trainings, online and on-site master classes. Then we had a wonderful format. We had online hackathon where Julia and her team participated and got the first prize. So they are winners of our cross-sectoral arts and health hackathon. So then we had as well a really good resource that we published, and this is the casebook that you can consult there on the table, and leaflets that you can scan the QR code and know more. The casebook that tells you really success stories, but really on the scale that everyone who want to work in arts and health and earn some money, they can take these models and try to do as these companies and individuals did already. In this context, maybe I will quote one of the artists, Minna Savolainen. She is photographer, Finnish artist. And in exploring what it means to be an artist in today's entrepreneurial and cross-sectoral landscape, Savolainen says her work is as well featured in this casebook. And exactly what has been just said in a moment. She says that we should recognize how incredibly diverse, interconnected artistic work has become. She says, today an artist is not only creator but also connector, researcher, educator, and social innovator. So it's not an easy task to handle all these multifaceted roles. One must master like many skills, and this shows really how much solidarity and support are truly needed to sustain these creative practices. And we recently held as well the final event of the project in Helsinki, and one of recurring thought shared by really several speakers was the same common old idea: the future of arts and well-being depends on collaboration. But really, like, whomever came to share their experience repeated the same thing. So, and actually, when public institutions and private actors work together, then creative entrepreneurship can move from isolated initiative towards lasting systemic change. Thank you.
All right. Yes, I would like to turn to you to see if you have some questions or maybe additional perspectives to bring, especially to this point on how solidarity, how togetherness, how collaboration can make this interdisciplinary work a safer space for both those that we are working for through our interventions, but also for those that are working in these environments. Anyone?
Thank you all for the great points you made, and I think it's very important to have a realistic approach to this kind of artistic endeavor. I produced several projects dealing with difficult communities, a project that happened in a high security prison, projects dealing with communities, projects dealing with disabled children. And an important conclusion was that not everybody can do this. And I think it's important, it's essential to have this kind of approach, but for the artist it's very important to be realistic and to have a very clear evaluation if you are or you are not able to do this. Because unless you evaluate your resources, you can get really damaged. We supported in the 90s a group of artists who volunteered in a HIV positive section of the hospital in Bucharest, and they did all sorts of creative projects. First of all, we were not aware, what Julia said, also the producer has to be aware about the risks and about how to take care of the people involved, of the artists involved. We were not aware of a long-term involvement. So after 3 months, they were down totally. They were depressed. They got all the anger about the cruelty of the situation, which was turned against the medical assistants, against the doctors, against the medical system itself. And they had to go into therapy for a long time. Then when you work with inmates who were criminals, you see them, they look nice, women and men, they do their nails, they comb their hair, they color their hair, they have a nice conversation. But a woman took an axe and killed her husband. And you talk to her, and she's a good conversation. But then you go home and you think, how can that happen? How can I trust mankind afterwards? When I have a certain approach and the experience fits to my values, and then I get the background information, and I realize that things are not as they appear. And I'm saying this because, in general, the creative crowd is very empathetic and very sensitive. And you always project the good things. You always expect the world to be beautiful, kind, good, but it is not always like that. So unless you get trained, you get to know the context, you inform yourself very well, and you evaluate your resources, don't get into this, because it can be a very tricky choice. However, it is essential, it's very important, and it can give you an immense reward, both at human level and creative level. And also think about an exit strategy, because you sometimes are seduced about the results. You feel like a Wonder Woman or a Superman, and you feel like healing the world and finding the best solution for everything. But then you create a certain dependence. The people you interact with put their trust in you and expect from you something that you are not able to deliver. So you always have to be present in that situation as an artist and take the responsibility for an artistic contribution. Not social worker, not healer, not medical support. So I wanted to share with you my experience and to
Great points, yes.
complete what was already said, and I think it's very important to remember the points which were made today.
Yes, it's very important, as you said, as also Julia said, the training. For example, in Cresc, we are supervised by two people. One is a psychologist and one is a somatician that is working 30 years in this field. So, and he's very Thomas Grail. He can give the good advices to us. There are a lot of trials and errors, and I feel that this is also the good of a pedagogy. A good pedagogy and a good intervention means that you are trying and you are making a lot of mistakes. For example, one part of the research is the case studies in the special school, pilot special school Sfântu Nicolae, which is very open, and of course that we had some problems there. We were functioning very well with certain kids, and with certain kids was functioning till one point. And this was very interesting because Thomas was telling us, don't push. If the kid or the teenager doesn't want, he has the right, because usually these kids has not the right to say no, because the process is to impose, to give, like Basaglia said, that you have to do some things. It's something that you have to do. We open a space of interaction, actually, and if the kid doesn't want and we give some tools, he has to make a sign, actually, because sometimes they cannot even write, they cannot speak. We know that we don't push. We don't push. We respect a lot the limits, the personal the personal no. It's so important, the no that the kid tell to you. And about also the impact, for me, so interesting because it's not measurable chronologically. So for me, the impact it has another temporality. Because you can, it's like when you have a child, you don't know how he will develop. You don't know. You have a project, you make a project for him, and you have a desire and an intention, but you have also to give time. We were speaking yesterday about slowing the time, and this is so important in the artistic process and also in working in communities, to give time to things happen. You are ready, but you can really give time. And you can oscillate a bit. Yesterday, there was a lot of like tiredness, and I think that a solution in a somatic way would be to oscillate. because we cannot stay just in the in the Taoist mode of non-action. We are not a society prepared for this, but we can oscillate from, and this is the work we are doing with neurodivergent kids. We oscillate through big exciting so giving a lot of energy to the system. They are really energetic, high, and then little by little you put a break. Little by little you start to calm down, and this is very interesting how we can oscillate, and at the same time there are these cycles, and this is so nice in the pedagogical field to make cycles of temporalities where you are teaching something theoretically, you are doing, and then you're reflecting, and then maybe there is people that is not so interested, no? The attention, we can see from your bodies when the attention is going down. So you have to give time to come back with the attention. You have to have your own, so the sensing where you are not here anymore, and you need time, and you need maybe to go out, and you need to be a little bit anarchic in the way you perceive also this kind of pedagogical learning process.
Okay, just a very small feedback. Thank you for you made a very good point. And I can confirm this state of vulnerability, when you work with vulnerable groups, such, elderly, or, a mate, or other vulnerable groups. So I think it is very important to harmonize, the expectations, of, the people, from vulnerable people, and you as an artist or psychologist or, any healthcare professionals that work in the project. And in our case, for example, my colleagues, artists, it's a need a preparation of these artistic interventions in this kind of environment, and they work together very, consistently in order to provide, the the interventions in a way that, to capture the others. I mean, they felt, hostility, against, the artists or, the others. I think it is a process, you have to prepare this process in, certain phases, and starting to know the needs, of the groups that you address, or, even when you work with students, because students are a vulnerable group, and to put together two vulnerable groups, so you have to find, a bridge, not to be one at the end of the bridge and the other on the other end of the bridge. You have to make them to move, on the bridge. So I think it's a very good point. Thank you very much.
Thank you. Julia, you want to respond?
Just very quickly, I just want to underscore what everybody has been saying here, that when we're talking about working in a health or social care context, it's not just art. I think maybe we can see that now from all of these conversations. It's more than art. It requires a great deal of intuition and adaptability and skill and thoughtfulness and intention. So what you were saying about autism and understanding, what is the psychological pattern? What are the interaction patterns of a child like that? That requires awareness for you to know, I'm just not going in to do an art project or a dance project, right? It requires a real set of knowledge and skills to be able to design these programs to be not just appropriate but also effective. So I want to highlight and recognize the artists who do this work, and the fact that many of them have learned to do this work by shadowing, by being mentored by having experiences with other experienced artists. So I think that's really important for us to consider. Thank you.
I really love how we are just completing the picture. Yes, we have a point here.
Thank you. I just wanted to thank you because for me that was the most important point made in these conversations that we have. And this is somehow the difference that I was thinking of when I mentioned the master in theater, because there is a difference between a master in education and a master in this system where you can train artists. It's very important, I think, the engagement of universities and faculties to really teach artists how to deal with this. Because there is so much scientific background in this and has to be completed. The artistic practice and the artistic training must be completed with these all inputs that we have and with all the research that is available for artists and all the practices. Because working with vulnerable people, it is indeed very difficult, and you need to be intellectually prepared for this. Otherwise, I think it wouldn't work. So that's why I'm welcoming. I think it's a matter of caring for artists, preparing them for the work that it has to be done, and I think that it is important to be done at academic level, not just in small trainings. And I think that there are so many models around Europe with different diplomas and different masters across all Europe engaging with this kind of work that are being done for 20 years, 15 years, 10 years. And we found them in different universities. I think in Spain, for example, there are different diploma courses in the psychology faculties or social science faculties where they teach artists how to work with vulnerable communities or in hospital settings. Thank you.
Yeah, thank you. I think we are going to a close. Yes, we take this one last point, and then we are going to a close, because then we are preparing for a small artistic-led moment, and then very briefly after that, lunch. So, please, Mirela.
I just want to add a little bit of comment on what Julia and Irina were saying. From my experience of working in art education, in a program of Teach for Romania in vulnerable communities with children. And what I want to say from my experience is that it is very easy for us to project and impose on the people with whom we are working what we think is good for them and what we think is valuable for them. And that was a very big lesson for me for working there for 2 years. What I would say is that we need a lot of adaptability in order to really assess which are the needs and how can we create a bridge between ourselves and our vision about the world and what people would need and what they really need. It's a big task, I think. And sometimes also, just to make it to feel a little bit hopeful, is that sometimes just a simple kindness and very, very human gestures might do quite a lot. Thank you.
Yeah, absolutely. And I think this links a little bit what we've been talking here, because Valentina was saying about the importance of listening and giving space to the participants to say no. And Ioana told us how actually they went for several times into the elderly care home before starting the intervention, and it's like standard practice that you do co-design with your beneficiaries. You don't suppose what the reality is because you are smart and well informed. It's even the same intervention needs to be readapted because you have just a particular group of people, and who I don't think who we were talking yesterday about even 2 generations of students at the same discipline, they have completely different behavior. So even 2 groups of kids in 2 different classrooms may react completely differently toward the same intervention. And thank you, Dace, also for your reflection, and thank you, Julia, for also giving us from the beginning also the reality of what are the well-structured perspective on what are the red flags what are also the rewards that keep us engaged and motivated with this work, but also the examples of practice that sometimes can be implemented at my individual level practice or organization practice. I love it when we can talk about systemic responses, but I think we should never ignore the things that we can do by just, you were giving this example, we decide as a collective that we will always include in all our projects that little bit of amount of money that we will include in our application that will be about taking care about ourselves or preparing our work to meet a vulnerable community. When we decide that we are prepared to work with a vulnerable community, and this is indeed our calling. Thank you so much.